Intravenous cannulation is a technique in which a cannula is placed inside a vein to provide venous access for the sampling of the blood, as well as the administration of the fluids and the other things. A cannula is a tube that can be inserted into the body, often for the delivery or the removal of the fluid. A cannula is composed of the following parts: an injection port with the cap, a catheter hub and the wing, a catheter, a lure lock plug, a stellate, a flashback chamber, and a needle grip. The indication for the IV cannulation include the repetition of the blood sampling, the IV administration of the fluid and the medication, IV nutritional support, and the IV administration of the blood and the blood products. There is no absolute contraindication for the IV cannulation, but there are relative contraindication, that is, to avoid the extremities that have the massive edema, burn, or an injury. In that case, try to access the other side. Avoid going through an area of cellulitis or an extremity with an indwelling fistula. These IV cannulas are available in different colors and sizes. Only 3 of the most commonly used IV cannulas are shown. Because of the difference in the diameter of the catheter bore, we have different flow rates, and they are selected according to the need. If one is unsure about the size of the cannula, one can also look at the back of the packing. The sizes are also mentioned at the back. This is how an IV cannula looked like without the stellate and with the lure lock plug in its place. A syringe attached to the injection port, an IV cannula with the injection site of the infusion set attached with the lure connector. The different materials required for this procedure are the alcohol swabs, tourniquet, adhesive tape, a disposable syringe, gloves, IV catheter, infusion set, and the gauze. This is a small demonstration of the cannulation procedure. After the identification of the vessel, the needle of the stellate is inserted into the vessel. Once the bevel of the needle is within the vessel, there is a flash of blood in the flash chamber. Once there is a flash, the cannula is advanced slightly within the vessel and the stellate is slightly pulled backwards. After this, the rest of the cannula is pushed within the vessel and the stellate is removed. The lure lock plug is secured with the lure connector. This is how a flash looked like in a flash chamber. The information regarding this procedure is given to the patient. The patient is also explained why this procedure is required, what are the possible complications, what is the indication, what are the precautions, and then an informed consent is taken. The hands are properly washed and the gloves are donned in a clean or a sterile technique. An assessment of the site of the cannulation is done and the vessels are identified. This patient has the vessels that are very prominent and very easy to visualize. A tourniquet is applied by limiting the flow of blood. Tourniquet helps in the visualization of the vessel. The skin at the site of the cannulation is disinfected by using an alcohol swab in the circular motion, and then the area is allowed to dry for some time. The skin is stretched to straighten the vessel, and now a small part of the catheter is inserted parallel to the vessel. Once there is a flash, the cannula is pushed slightly within the vessel and the stellate is pulled slightly backward, and then the rest of the cannula is pushed within the vessel. Below the lower connector, a gauze is placed to prevent the spillage of the blood all over the site. The tourniquet is now released. The lower lug plug is attached after the removal of the stellate. The blood in the cannula confirms that the cannula is now within the vessel. The cannula is now flush with the normal saline. The blood on aspiration shows that the cannula is now within the vessel. Adhesive tape is applied to secure the wings of the cannula. The date of the cannulation is mentioned. The possible complications of an IV include pain, swelling, hematoma, air embolism, phlebitis, extravascular drug administration, and an intra-arterial injection. With this, the procedure now comes to an end.